Maurizio Ghisoli. I'm a Pediatric Hematology Oncologist working on Mary Crowley and Texas Oncology. Well, I grew up in Venezuela, but we moved to Venezuela from Italy when I was really young. So I mostly grew up there from Italian family. My wife is from Venezuela and we have 3 kids. We love outdoor and we love camping, primitive camping in a tent. First things that I think that kids are fun. I love to see them grow in all the stages of different changes at different ages, and that's a passion for me. I think a surprise is the strong will they have. We tend to think that children are more fragile, but they endure a lot, and most of the time I think they endure and they can handle emotionally and physically chemotherapy treatments even better than adult patients. They even become protective on their parents. Instead to be the other way, that they are the parents that protect the kids, are the kids or the patient protecting their parents. Mary Crowley, it's a research center, but it's really patient focused. It's all about bringing something to the patient in a rapid way. It's not the typical basic science. This is more practical. It's a more pragmatic approach that goes directly to the patient. I think that Mary Crowley tried to look outside the box. The things in pediatric we're doing, it's definitely different. It's play with the genetic of the cancer, we play with the immunology of the cancer. And this is the new hope. I think that we have maximized for most of the diseases the amount of chemo or the type of chemo we can give, and now it's the next step, the immunotherapy or the molecular therapy. And that's the case for the Ewing Sarcoma, where we can focus our research now to bring something different than chemotherapy. That most of these patients, they already have so much that it's not, the hope is not there. It's in something different, a different mechanism to explore. Okay, so Ewing Sarcoma is the second most common bone cancer in pediatric and young adult population. Most of the patients may respond at the beginning, but it's common, to disease to come back, and after the disease come back, become a challenge. It's most of the cases are incurable, and we have maximized the amount of chemo that we can give to these patients. So it's time to look for something different. We look for what we call the double punch, the 1-2 punch. We're trying to hit the immune system, re-educate the immune system so it can fight cancer, and also we're looking into the molecular basis of Ewing sarcoma, why this happened, and trying to attack and block these oncogenes. These are molecular therapy approach we have. Now, we don't cure patients, but at least we're controlling the disease, and we're transforming these rapidly aggressive tumors in something more chronic. Like you don't cure hypertension, you don't cure diabetes, but maybe you control them. And this is probably the initial step that we're trying to do with this immunotherapy approach, and as well with the molecular approach. I think the immunotherapy it's now widely recognized as the new frontier or the new approach to treat cancer. But the unique about our Ewing sarcoma vaccine is that it's a whole cell, so we use the whole antigen repertoire from the patient, and it's personalized. It's unique for each patient that we see.
I think this is a wrap.
Yeah, we're done.
Oh, that was fast.